Okay, so we are recording. Okay. So do we just want to go like side by side? Okay.
Yeah, sure.
Okay, so for our international health project, we decided to do a HIV prevention program. And because HIV is a rising health issue worldwide, we decided to focus on a country that has the highest HIV rate and create a health program to help combat this growing health issue. The country that our focus is on is the country of Swaziland in South Africa because they have the highest rate of HIV cases that are documented, and there's probably even more that are not documented. If we are able to assist the country with our plan, we will hopefully be able to implement it into other countries that are also dealing with this growing health issue.
So we chose Swaziland, just like Jessica had said, because of its high rate of infection. So more than 250,000 people have HIV in a population of 1.1 million. HIV is especially prevalent in this country in women who are pregnant, with 39.2% of the pregnant women population being infected. Additionally, about 17,000 children are exposed to HIV during birth each year, which is preventable. Women play a huge role in Swaziland's community, just like in most African countries, but women between ages 14 to 49 are over half of the infected cases. And because women play such a huge role in the home and in the community, that leads to children becoming the head of the house when the mother is sick, decreased community strength, and little to no income to provide for medical care. So it's kind of just like a snowball effect of the mother gets sick, then there's not any income to provide for that medical care that she does need, then the children become the head of the household. And about 130,000 children are either considered vulnerable or orphans because either they have HIV or their parents had HIV and were unable to take care of them. So this is a huge issue, and all these numbers are specifically from Swaziland, but HIV is a huge issue around the world, but starting in a community where it is so prevalent will be really important.
Okay, so the way we planned this prevention is to create and implement an education program and using the cultural and social positions of the community so that they can spread the education and hopefully have an impact on everybody in the communities, both rural and urban, so that every population is reached. Our education program is based on the preventative measures, both for prevention and if you have HIV, how to go about preventing the spread of it, and also for mothers pregnant, for their delivery, breastfeeding, everything that way. Our plan is to create pamphlets and distribute them to the individuals with the education of the prevention for HIV and how to go about preventing it and treating it. We decided to do pamphlets because it would be easy to take home, so it's available for all household members.
For this program to be successful, we are heavily relying upon the importance and power of education. By educating the citizens of Swaziland, we are providing the opportunity for change, knowing proper prevention strategies, and also by providing the resources needed. Like condoms, individuals can practice safe habits to decrease the exposure of HIV. Also, by educating those who are HIV positive about treatment options available, we can decrease the HIV exposure. This is especially important for pregnant women when they receive antiretroviral medications and are aware of the risks of vaginal birth. Mothers can protect their children from contracting HIV as well. This alone can have a great impact on lowering HIV cases for future generations and increasing life expectancy in Swaziland. By providing pamphlets that contain important information regarding HIV prevention and treatment options, we are providing information to travel easily across the country. We understand that not everyone will have the opportunity to be taught about HIV safety, from a political, medical, or educational leader. So these pamphlets can be distributed to try to further educate populations that may otherwise be overlooked. Additionally, pamphlets will be in people's homes as a reminder of the precautions to take and to further clarify why HIV prevention is crucial. Some concerns we have regarding our program involve the political upheaval that is happening in Swaziland. World Report states monarch King Mzwadi III continues to repress political dissent and disregard human rights and rule of law. This concludes Swaziland's struggle to fulfill the rights of its estimated 1.4 million amid numerous political and socioeconomic challenges, including the highest HIV infection rate in the world. With such political contention within the country and having a government who is unconcerned about the wellness of their people, there will be difficulties in getting this program to be approved for implementation. Another concern is related to the political distress and is that of Swaziland has a rape rate of 77.6 per 100,000 persons. This is a high rate of rape and can also be one of the factors as to why HIV infection is so high. This is another problem that Swaziland's government currently is not working towards fixing, and because of that, HIV transmission will continue on. Thirdly, there is a concern about reaching individuals that live in rural areas, since most of those areas are not easily accessible. And finally, like with many international health problems, there are concerns about properly motivating people to get tested, take treatment, use resources, and understand the significance of this problem. We can educate and explain the benefits of HIV prevention and provide necessary resources, but as a country, as a culture, and as individuals, everyone must make HIV prevention a priority.
Okay, so there, as Asha said, there's many concerns. There's also some barriers. Some of the barriers are the fact that the majority of the country only has a 6th grade reading level, so we would have to make sure that any of the material that we provide for any education only goes up to that reading level so that the majority of individuals can understand it. And reaching individuals in the rural areas, as Ashley said, because it's hard to get to, we need to make sure that individuals of the community are informed so that they can spread it throughout the information throughout their communities. We have some concerns, so we will be educating the mothers, any government officials, teachers, and healthcare facilitators, and so that they will be able to help spread that information to the entire population. And another concern is also mothers being tested early enough during pregnancy and while breastfeeding so that they know whether or not they can breastfeed their child, to make sure that they get on any medication early enough in their pregnancy. Re-education does need to be done for these pregnant moms so that they are aware of the need to schedule a C-section if they are HIV positive, and whether or not they can breastfeed their child so that they don't spread HIV to their child.
The 4 groups that we mentioned earlier, the first one we'd like to address is mothers. Some of the barriers that we have going on here are that women in this culture have not had equal rights, especially the concerns of safety and health care. In this male-dominated society, cultural expectations regarding intimate sexual relations could preclude the well-being or health of women. Prior promotion of breastfeeding by healthcare organizations such as UNICEF would be detrimental in this situation, because breastfeeding, while it is a natural, healthy method to give babies the nutrients they need, a diagnosed HIV positive mother could pass the virus to her child with breastfeeding. Also, the education level of the mothers could be lacking, not only in HIV awareness and prevention, but also the mother's reading level or ability could be a detriment or a stumbling block so far as the reading material not being able to be understood. Mothers may not be aware that they've been infected with the HIV virus until much later in their pregnancy. And in rural settings or regions where medical health care is quite limited, vaginal births could occur without knowing that this birthing method should be avoided with a positive HIV mom. So far as solutions, early and routinely attended education classes should be offered and strongly encouraged so mothers have the information to safeguard themselves, their unborn children, and their newborns up to the weaning age. Early detection is extremely important. In the case of the country, with over 25% of the adult population being HIV positive, mothers should not only be knowledgeable about what the HIV virus is all about, but they should be tested if there's any question that she could be infected or her spouse or boyfriend could have contracted the virus. Interventions, as I mentioned, the early detection is very, very important. Women should get tested if there's even a chance that they've been exposed. If a mom is HIV positive, she should have the information readily available to her so she can safeguard her children. Especially like during pregnancy, what HIV medications should be taken, how not to transfer the virus to her unborn child, scheduling cesarean births, and abstaining from breastfeeding. Now with government officials, the barriers are much more of a, I would say, economic, but also cultural view. The long-held attitude of male dominance in this country is a political and cultural barrier to the promotion of both men and women needing the education tools to prevent and intervene with the spread of HIV. There's also the attitude of casual sex and multiple partners, which has been an issue. Homosexuality is against the law in this country, but there is a segment of the population that does participate. Reaching this segment could prove difficult because these individuals may not feel comfortable or feel free to participate in education classes. So far as solutions with this group, this focus group, we should present to local and national leaders that it is the best interest of the country to promote these education classes. In one of our reading assignments with Who's What's Working, I pointed out that improved health endeavors were obtained when political commitment came about because technical experts were able to effectively communicate that a big win